By embarking upon this program, I cannot tell you that it will be easy. I'd be misleading people if I did, but I can tell you it's worth it.
It's a good school for the reputation, for the opportunity of the caliber of students that come there, for the caliber of instructors that you get.
Being a distance learning program, it allowed me to continue working full-time and explore my interest in public health.
Before marriage to wife Jessica and the birth of their daughter Jillian, Booker Daniels worked in the marketing field of the pharmaceutical industry. At the time, he contemplated a change.
I found myself increasingly interested in public health, applying my knowledge, skills, and abilities to advance people's health as opposed to advance the bottom line.
He wanted to work at the Centers for Disease Control and Prevention in Atlanta, but worried that his existing skills weren't enough for the change.
It seemed daunting. It seemed almost impossible to make a transition from a career in private sector marketing to working in public health.
Daniels found his mid-career path to public health and the Rollins Career Master of Public Health Distance Learning Program, completing most of his coursework online.
You'll be amazed to find how much intimacy and how much content and how much richness there is to interacting with your peers and colleagues online. And it was more than I could ask for.
Today, Daniels is a health communications specialist in HIV prevention at the Centers for Disease Control.
The curriculum is unique. It has majors that you will not find anyplace else.
Dean Miner says the career MPH is rooted not only in Rollins' stellar reputation, but also in a cutting-edge program designed specifically for working professionals who may have families. Most of the work is online with brief interaction on campus.
They come to class twice a semester. They see each other face-to-face at the beginning of the semester and the end of the semester. And in between those two face-to-face encounters, then they have online instruction.
Students who have at least 5 years professional public health experience can earn a CMPH degree majoring in prevention science, healthcare outcomes, and applied epidemiology. That's just 7 semesters or 42 credit hours without interrupting their current career or family responsibilities.
Without any doubt, this program is absolutely exceptional, very convenient for someone who's a professional, has family, has commitments, and is willing to invest a little bit of time with good effort to complete the program.
It's difficult, but it's incredibly stimulating and exciting at the same time.
An ideal situation for CMPH student John Abel. The music therapist is going back to school to broaden his future career options while keeping the rest of his life intact.
The structure of the CMPH program really worked for me. Just as far as having that flexibility, the way my work and family life can balance out now is very nice. And at work, I come home, I can have dinner with my family, and then I can go hit the books. So it doesn't pull me away, you know, from taking my son to football practice or my daughter's soccer games, or, you know, things that I don't want to miss.
The Rollins Career MPH web-based program uses software called Blackboard to deliver easily accessible graduate courses. Also easily accessible are the program's in-house instructional design team, technology support, and most important,
if there are any EpiInfo issues that come up, we've got a discussion board.
Faculty are world-renowned, certainly are experts in their field, coming from Emory, coming from CDC, coming from other institutions, and students get to interact with those individuals, get to know those individuals.
In class or online, Senior Associate Melissa Alperin's dedication to her students is typical of Rollins faculty.
In the CMPH program, I'm interacting with my students all the time.
Instructor Sean Kaufman is a bioterrorism expert whose other career at the CDC finds him frequently out of the country.
In the next 4 weeks, will be in Taiwan, I will be in Thailand, I will be in China, and I will be in India. And I will still be able to teach my students remotely.
Interactions that define not only the faculty-student relationship, but the students' connections with each other.
It started the social networking before it became vogue, and it really emphasized, you know, to draw upon your peers to really learn what's really happening.
There were people there from backgrounds as varied as pharmacy to dentistry, nurses, physicians, and so all of that kind of came together to really give me, you know, a lot of knowledge that I probably wouldn't have been able to gain just from, you know, sort of sitting in front of a computer or just sitting in a classroom with other folks.
It's a powerful dynamic. Top-notch faculty and students, all with a heart for public health, researching and learning together in the heart of what Associate Professor Ira Smith says is the country's most exemplary public health network.
Rollins, I think, is very strategically located. Being here in Atlanta, we're right next door to CDC. We're in the same city as the American Cancer Society's national office and CARE and other national and international public health organizations, and we collaborate extensively with all of them.
As part of their collaborative studies, students work in groups of professional cohorts committed to lifting up their communities and the world.
I find great value in the community and real-world orientation of the coursework. For example, a community needs assessment course that I took, we actually partnered with folks at Grady Hospital, and we worked with them on a real program.
Instructor Grant Baldwin also works at the CDC. For him, public health is much more than just a career.
It's the thing that wakes us up in the morning. It's the passion that we all have in our gut to do good. I feel better going to sleep at night knowing that some portion, some small piece of the work that I've done or the skills that I've tried to educate others about will make a difference in improving people's lives.
It has made all the difference. I can honestly say that the CMPH program has opened a variety of doors and opportunities that frankly I could have never foreseen.